I want to show you guys, when you get the device, this part in this small area is where the microchip goes. And when the device is brand new, this white thingy which moves is lower than what it usually is. Okay, so I will show you now what we need to do when we purchase first the device in order to be able to put the microchip. I'm telling you this because sometimes we get like, oh, the device is not working, I cannot put the microchip. No, you first need to do 2 movements with the device only. That's it. So, okay, our model is ready. Please, welcome. She was sharing with me, she has a sensitive skin. She's scared of pain. So we will not torture her too much, just a bit. What's your name?
Evelyn.
Evelyn. Good. How old are you, Evelyn?
43.
Evelyn is 43.
2 weeks I'm gonna be 44.
Okay, good. So I will not say congratulations because we don't do in advance, but very good, perfect. So what we see is some capillary fragility, some broken blood vessels in this area, beginning of some fine lines, expression wrinkles are there. Photoaging starting normal with this age. It's fine. You know that the photoaging is not because last summer I went to the beach. This is because our skin has memory and it gives us back what we did to it when we were younger and unconscious. Okay? So, can I have this up? How does it move? Please. Like the whole bed up? Can I?
I'm not sure. Maybe this.
No, it should go up. Okay, no, that's good. Are you okay, Evelyn?
Yes.
Good. So for Evelyn, I will do salicylic together with mandelic so that I can improve as well the more uniform skin tone of the skin. And plus, she said she has sensitive skin. I can work on small spots here and there. Keratolytic will be very good because she has some obstruction and miliums. So it's a skin which is more prone to get blocked. So exfoliation is super important. And good. Gedrike, okay. The water. It's good. It's okay. No, it's okay. It's fine. I will ask you to change it later on. Cool, so we can start. We will take a picture of her, asking her to please sit up after we do the cleansing of the skin. Or actually better even now, because she doesn't have anything Yeah, so can I ask you to please sit up, Evelyn? And so this is how they look like, the duosomals, like they come in capsules, in monodoses. Very easy and practical to work. And we will start, as always, with preparation of the skin. First cleansing, and this is going to be energizing cleanser. You took pictures? Cool, thank you. Okay, so this is a gel. And energizing cleanser is our top selling product out of 140. And I would like to, Yedre, please let them try just a small drop so you can have the feeling and sensation. It contains cinnamon, ginger, and turmeric. So we know cinnamon is a great activator of the micro blood circulation. And turmeric and ginger have anti-inflammatory properties, and in the same time, ginger is a great activator as well. So a good cleanser, as we said before, is the base for me to start constructing everything afterwards, yeah? It's like the base, the cement of my house. I will not start from the roof. I need to first put the base, right? So a good cleanser is going to assure the improvement and permeability of the skin. You can smell. Do you like the smell? Everybody loves the smell. Do you like the smell, Evelyn?
Oh, super.
Oh, super. Well, it's a different story when you're laying down, somebody is working on your face. But really, we had a salesperson who said, I will not call it energizing cleanser. I will call the product your spa at home. And really, like, personally, I use it. Like, it's a gel, you need to mix it with a bit of water and then apply and work on it. I leave it while I brush my teeth. So I put the cleanser, I worked on my skin, and then I brush my teeth. So I leave it for like 2 or 3 minutes on the skin. When you remove the cleanser, the change is visible. And you would say, really, with a cleanser? Yeah, but what a cleanser. This cleanser, that's why it's our top selling product. Because, you know, in South America, the products have the same price for you than for the people in South America, but their income is not the same as the one that we might have here or in Spain. So, unfortunately, not everybody can afford a professional treatment. And you know what they do? They sell home care. And you know what they do? They post before-after pictures only with home care. And you know what they do? Earn a lot of money. Only with home care. I don't need to work. Blah, blah, blah. Give me the money. The products are very good. Evelyn, do you feel anything?
Cold.
Now, but before that with the cleanser, did you get any sensation?
No.
Yes, today we had a demo and the model shared, she get the sensation of freshness. Sometimes it might give the sensation of heat. And if it's a very, very sensitive skin and dehydrated skin, it might give itchy sensation. This is how activating this product is. It improves permeability of the skin. So it's like it awakens the skin, it prepares it for whatever comes next. You can feel how clean, right, your skin feels.
Yes. Breathing.
And only with a cleanser. And the smell? The smell is the botanical extracts that we have. Cinnamon, ginger, and turmeric. It's important to cleanse the skin morning and evening. Some people say, but in the morning, why do I need to clean it? Well, because your skin in the night is when it works at most. And so it gets free from all that it does not need. So, in the morning, before applying our daily routine, we need to get our skin free from the rests of whatever our cells decided they don't need anymore. Plus the rests of whatever we applied at night. Yeah, creams, serums, whatever. So we have a clean skin on which to apply our daily products. And you cannot feel this, but I can feel like, you know, it's like squeaking from how clean the skin is. How does it feel now?
Very fresh.
She feels fresh. Can you see the glow and the shiny? You cannot see it. Is it visible on those screens? It looks like a bulb. And there is nothing on the skin. It's only the cleanser. Astringent properties as well. Evelyn, can I ask you to please smile? Can you see the nose and as well on this side of the cheeks how shiny the skin is? I don't know if from there you can see. And here it is not very visible, honestly. I don't know if on the other screens it is better. Okay, after having cleaned, bamboo hydrotonic. We apply, fix the pH, work a bit, and then we are going to do degreasing, because eliminating the lipidic part of our hydrolipidic layer is like, you know, removing the olive oil so that the water that I'm going to apply afterwards is going to be able to penetrate. What I mean by that is like we open the door, yeah, for our peelings to penetrate and give us even a more optimum effect and result. Degreasing solution basically is alcohol and medical acetone. So we are going to, doesn't smell as nice as the cleanser. So we're going to invite our customer to please breathe in and, you know, stand still for a moment while we are applying this product. And here with the degreasing solution, if you have, for example, an area that you want to give an extra effect with the peeling, you can rub and scrub a little bit, yeah? Because this is a cotton gauze. It's not the soft one, but the harsh one. So itself, the gauze gives me some exfoliating mechanical action, yeah? So let's say if I have a wrinkle or hyperpigmentation that I would like to insist a little bit more on, I'm going to use, you're a little bit peeling off here in this area. Why? Evelyn? Evelyn is asleep. You are slightly flaking in this area. Are you using something like strong product or?
No.
Well, she's already peeling off in this area, just a bit. I don't think it's visible, is it? No. Can you see? It's like flaky. Anyway, now would be the moment to protect. Protect from what? For what? This is our TKN protector. Okay. It's like a Vaseline, very rich, nourishing balm. And it is meant to be applied where needed, if needed. For example, imagine Evelyn has micropigmented eyebrows, like permanent makeup on the eyebrow or on the lips. Or, for example, she has a small baby cat which is playful and then she's scratched like a small micro lesion somewhere, you can protect. If people feel scared to work around the eyes, they can protect. Some people like protecting this area because it is extra sensitive. Personally, I'm not a fan. I think there is excess of dead skin cells, which I am interested in removing. So this is when we will use the protector as well. If there is a herpes, you don't have a bypass, do you? Evelyn? Hola. You don't have bypass. Bypass? The machine for the heart?
No.
Oh, okay. It's a contraindication for the electrical pulses in there. So, okay, having said and done that, Yedra, can I please ask for clean water? So, we open the salisome away from the person's face because we don't know. Sometimes it can jump out a small drop and fall where we don't need it. So, no need. Okay? So we apply one drop, and we distribute the product, okay? And only then we will start the application of the product. Cool. Evelyn is asleep, huh? She has relaxed so much, so let's see how it goes. As we said, these peelings, we work. We work with the hands until they have penetrated. It's a gel texture, so it's easy to control and to work on. If I have some specific area I want to insist a little bit more, I can, like frictioning, for example, on the forehead, on the fine lines and wrinkles, or if I have a hyperpigmented area, I can insist a little bit more. And when the peeling is absorbed, when the product is absorbed, I will leave it for like 5-7 minutes. Remove with water. Yeah? The disposable tissue. The one that I bring. You throw it away? No need to throw away. It's okay. No. I like working with this, but I use one for the whole treatment. Don't throw it away, please, for the next one. It's okay. Okay, so after 5-7 minutes, we remove. Example, if I am treating acne and I want to do extraction or comedolytic skin, I will remove the first salisome, extract, and apply a second salisome. My question was, when I heard this, isn't it too aggressive? No. Because you know, salicylic acid as a beta hydroxy, it penetrates through the fatty channels, and it has this deep cleansing effect. And as well, it is anti-inflammatory and bactericidal. So for skin which is problematic and prone to clog, then it's really going to give us very good results and effects. Plus, once I have removed the comedone, I finally am able to penetrate that spot. Because if not, you know, it's like a hard, thick, oxidated fat, which sits there and nothing can penetrate through it. We remove. We said salisone, we are not going to apply on eyes and lips. No need. We don't need salicylic acid on those sensitive, thin areas. But we can, and I will, apply mandelic acid, for example. Can I, Evelyn? Evelyn, what is this, siesta time for you?
Super feeling.
Super feeling. Nice. Did you feel anything? Burning, itching, pain?
Pressure. Like skin was doing like this.
With the peeling?
Yes.
Interesting. First time I hear something like this. So activation of the skin, I would say. Like this, doing the skin. Like she felt there is something happening. Usually people don't feel anything. So it's good. Very important after we clean, as I mentioned before, dry. If I put now on wet skin the second capsule, I am automatically neutralizing it. Because what is it, the neutralizer? Water. Yeah? Okay. So, mandelic acid, same way of application. I don't need to break this part of the cap. No need to stand there and lose your time. No, just put it down. Once again, put your 2 fingers here so you make sure that if the product jumps out, it doesn't go to the area we don't need it to go. Why do I first apply all the drops? Because if I first start extending the product on the forehead, by the time I reach down, maybe it is 1 or 2 or 3 minutes extra time than the rest of the face. So apply first the product and then start with the work. You will see a big difference in terms of time and absorption between capsule 1 and capsule 2. Why? Thanks to the super powerful keratolytic action and effect of the first one. I go for the lips and I go for, open your eyes please. I go for the eyes. Close. It has already absorbed. Because we have already, with the first one, removed a lot of dead skin cells from the surface, and skin is much more able to absorb whatever. So we have improved the permeability a lot already with the first capsule. So as I said, do I need to double exfoliate? No. She said she has sensitive skin. Okay. The truth is I applied very short time the salisome. But the mandesome I'm going to leave. Because in the meantime, I'm going to show you the device. Can I have the camera here, please? Okay. So, the device. There is the switch on the back. We switch it on. We continue switching it on. We get to a touch screen. And we get to this visualization. Now, I need to go backwards with this small button here called Set. I press on it. And remember I told you about this white thingy? Aha. Okay, this here. Look at how this part, small part, white, is going to move upwards. So I'm going to be able only then to put in the microchip. So we press back and look at the movement. Replace. Did you see how this thingy went up? Okay. Here you have the options of syringe size. I recommend you to work with 10 milli. Because in 10 milli syringe you can put 5 milli, you can put 7 milli, you can put 10 milli. If I work on face, neck and decollete, I need 7.5 milli. If I put 5 milli syringe, I need to stop, extract the product again, I lose time. And it's a question of being practical and go and do and get money. Okay, so 10 milli syringe, and then what we are going to do, we prepare the microchip. They come packed individually and in a sterile package, right? So we open, and this is how we put it. Okay, it has a small ring here. Okay. This small ring that you see here, it is going to go inside the white via that we mentioned before. Yeah? So I press in, forward, and then I need to, it's blocked. This is as well very good, because if you get a blocked chip, it's not moving. Very gently and with love, you just move it. Unblock it and move it, okay? So, we said this small via is going to go inside. Press it, and then you have to press on the side until you hear the click. Click is there. And this is ready. So I need to prepare my products now. This is a strange. I'm not able to see exactly the color of the skin. Okay. No, she's good. Because she said she is sensitive, so I wanted to check if there is any reaction. So we will I will work with our anti-aging starter kit, which combines MESOLIFT for firming and lifting effect, extra nourishment with NCPR and MW, which is our medium weight molecular weight, yeah, hyaluronic acid, yeah. So we said we will use 10 milli syringe. 10 milli syringe. And what I am doing is I am holding the MW downwards because it's a very thick gel texture. And yesterday I had a question from a customer saying, listen, this is very difficult to extract. I said, no, it's not. You need to give it some love. Keep it close. She said, I keep it in my bra. I said, so then what's the problem? It comes, I asked her, what needle are you using? She said, no, the one that comes with I don't know what. You need 18 gauge needle. If not, it can take forever. Okay? So please change the needle. 18 gauge needle. Okay? You put in the needle. And then the vial is new. I open it. If I have been using it before and I'm going to use it now again, I advise you to please disinfect with a bit of alcohol or chlorhexidine, whatever, before you start the extraction of the product. So this is 18 gauge needle. You can see a huge one, the biggest actually possible. And so we put in the product, the needle in the product. You can see the needle is inside the product. Oh, you cannot see. How shall I stand? This way, I guess. Yes. Okay. So you can see the tip of the needle is inside. And very slowly, I start to pull on the product. And you can see that the gel is already coming into my syringe. Can you see the gel? It's already in. Can you see the gel in the syringe? Cool. That's how easy it is. Stop. You extract whatever is here because it's a lot of product. Absorb it. And here I invite you to change the needle. Because if I am finishing the next product, let's say I have only 2 milli of NCPR, no need to change the needle. I can use the same one. But this is not the case. So I don't want a cross thingy of the products. I can mix them, but we better not mix them inside. So we change the needle. Evelyn, how are you? Good? Feelings, sensations? Burn, pain?
Very fresh.
with a chemical peel on. She feels fresh. Cool. This is NCPR. A new needle is there. We said products are sterile and aperogenous. 2 milli of NCPR, 1 milli of MW. That makes 3, and then I need 4 from MESOLIFT if I work on face, neck, and decollete. Change the needle again, please. Can you see the gel in the middle? It's stuck there. Can you see the gel? It's sitting there. I'm showing you this now because it's important to mix, shake, so we have a homogeneous texture. Then we change once again, and we go for the MESOLIFT. Okay, I'm good enough. I will work with 5 milli because today we have the time that we have. So I give enough space in the syringe and then I shake it. Vigorously shake it. And then we're ready to go. Okay, so now you can see the texture is homogeneous. It moves properly. No gel stuck anywhere. Good. I would recommend you to exit the air and then press it well in this part of the microchip. You switch it in. You properly press. And then you have 2 options for the syringe. Either this one goes inside this hole here. Here, so you can switch it in like this. Wait. Or this way I'm not seeing how much quantity. I cannot follow the quantity I am using and how much I have left. So if you want, you can do this. This wider part of the handpiece here, yeah, is where I'm going to put the widest part of the syringe. It does not stick like really perfect, but it sticks in perfectly enough for me to be able to work. I would advise you as well to press on the syringe because all of this has to be filled up. Okay? So we press, we can see the product is running up, and I'm filling up all this area. Cool. And then exit from here. Now, before exiting, we need to adjust this part. Press 4th, replace, and then with the button, just get closer. Where am I? Yep. Get closer to the syringe. Don't press too much. If not, the product will jump out. Even if I have 2 milli still left, I would better do it with the device. From here, the device, I put the exit. And then we need to set the parameters. Electroporation is how deep I'm going to vehicleize the active ingredient. 1 to 5. Okay? Aging process. I need to get down to dermis. I will go for 4. 5 would be like for very mature skin. Dosage is the quantity of product flowing out from the microchip. On the face, I recommend you to work with 3. 3 is okay. Head and body, everything on 5. Yeah, but for the face, doesn't matter the area, 3 is fine. Contact degree and frequency are my more mechanical parts of the device. So contact degree is how strong I am hitting the skin. And the frequency is the velocity. So on her, she's scared from pain, even though I'm going to start with a contact degree of 4. Let's see how she reacts. If I need, I can go down to 3, because this is not too mature skin, still, you know. But this is the activation of the skin. And then Antoaneta likes frequency 5. Okay, so for you to be able to see, can I please? Okay, so look at this. Look at how the microchip, how much it is coming outwards and how strong I'm going to be hitting the skin. Another important button is the cavity. Cavity means that the flow is open. Product will be coming out with the cavity open. Cavity closed looks like this. Dark blue with a tick closed. So, look at this. Start. See, this is how much and how strong I'm going to be hitting the skin. This is for anti-aging. Now, for acne, can I be so strong and activating for the skin? Definitely not. Put stuff on too, and this is how much it's going to go out, barely touching the skin. I cannot work activating the acne. Okay, I need to vocalize though on 5 for acne, because I need to get as down as I can, which is deep dermis. Now, for her anti-aging that I'm going to treat, I'll start with a contact degree of 4, and I like the frequency on 5, because it gives me more velocity, so I can go faster. And I recommend you as well, before starting, it's already here. Can you see the drop coming out? The drop is already there. I will not start to work without the product on. Yeah, so cavity is open, and we will start. Before we start, we need to remove the peeling. Desastre. So it has been for like maybe how many? 10 minutes, the peeling. Okay. No redness is there. A little bit of hyperemia on the chin area, no problem. Is it burning, paining?
No.
No? Good. Start from the lips and eyes, because these are the most sensitive areas. But still, Evelyn, she is not feeling any discomfort, pain, burning, or anything.
No.
Good. Perfect. It's a treatment that it's not painful. And as I said, it's perfect as well for when we have like some special event and we want to look amazing. We can go for a MESOJECT gun. Of course, it will depend on the type of product that we are going to use, but there will always be a visible effect, always. Good. Having done this, we dry the skin and we start with a MESOJECT gun. Okay. Handpiece is not heavy. Now the cable, it is. So what I recommend you is to just put the cable here. Cavity is open, and we will start and we will work by areas. So what I do now, already I am working, but what I'm doing is I apply the product. You go line by line. covering the whole area. How fast do I move? Depends on the frequency that my device is working with. As we said, we have protocols, everything is written. I'll show you in a moment how they look, what they look like. We have 21 protocols. We have 3 which are for grade 1, grade 2, grade 3 of aging process, where we recommend you what products to work with, how to set up the device, MESOJECT GUN, the parameters, like the products that you need for the phase 1, phase 2, phase 3, even the home care recommendation products. So now, product is there, I close the cavity, and then I'm going to work. This is frequency at 5, meaning velocity or speed at 5. If I put frequency at 3, can I move as fast? No. So it takes more time. Of course, I will need to work with 2 or 3 max when I'm working on acne, because there I cannot do this activation, right? Because I can stimulate and provoke even worse problems. So, horizontally, guiding part is this one. Horizontally, vertically. Yeah? Is it painful?
No,
Evelyn?
no, no at all.
Good.
Super.
Thank you very much. There is some hyperemia, as you can see. And you know why? Because of the 25 microprotuberances that we have on the top of the microchip. It's not needles, but it's teeny tiny bumps, which are going to give us even better result and effect using, this is an anchoring point. You see me, it's the only point where I'm pressing. She got really red here. It's okay. It's the only moment I'm going to press. So, horizontally, vertically, working on the visualization of the active ingredients, and then we look for the anchoring point, working on our lifting effect. I find the place, and I stay there pressing and shooting during like 10, 12 seconds. So, am I going to work until the product has penetrated? No, no need. Cavity is open, I'm going to continue with the application of the product. Because she has some hyperemia, I don't want too much redness, I'm going to put down the contact degree to 3. But I do not change the frequency. Frequency, again, will be at 5. I only accompany the device. I'm not going to press the device. If I want more pressure and more activity, I'm going to put up the contact degree. So it will be the product, the device to do the activation, not my hand. Sometimes it has happened that customers bought the device, they did not get a proper training before they started to use it, and they were complaining that their customers are in a lot of pain, they get scratches and stuff like that. It is not the device, it is your hand. If you press while you're moving, you will scratch. Yeah? But we never have scratches if we work in a proper way, and the proper way is I just accompany the device. The device is not supposed to be pressed. Cavity is closed, and I'm going to show you now how we work on the rest of the lifting points. Yeah? So we work on visualizing the product. Remember, when we put in touch the device and I press the button, because it depends on the button, the electric pulses and the electric wave that we spoke about, which is perfectly square and asymmetric and continuous, it is all the time working activating, stimulating the opening and the existing channels, and as well the opening, the momentarily opening of the microchannels of the cell membrane so that it can absorb properly whatever we are working on here. Yeah. So this is how we are going to work on lifting up the corner of the eye, working on the marionette line, like really stimulating this area, passing several times, and then I'm going to work on the anchoring points. Evelyn, is it painful? But you can feel it. It's not
Yes,
painful, but she can feel it.
pressure, yeah.
Yes. It's not painful because I'm not scratching. I'm just accompanying the device. Then this was number 2, yeah, working on the marionette line. And then where are the anchoring points? They are going to work just around the whole cheekbone. If I don't see where it is, I can touch, orient myself, and then go and work on it. Then we work on the nasolabial fold and anchoring point number 3. 1, 2, 3. Then we repeat anchoring point number 2. And I recommend you to repeat all of them like 3 times. So then you go horizontally, not vertically. You go from jawline and upwards. And basically what we are working on, this micro electric pulses, what they're going to do is they will have they will work on even on the muscle contraction. So we get teeny tiny contractions of the muscle, and this is how as well we get this tightening and lifting effect. How many anchoring points do we have? It will depend on each face. If you have bigger face, then you have more anchoring points. If you have a smaller face, then it's less. But I would recommend you to work like on each of them, repeating like up to 3 times, so you can really get this very good repositioning of the whole area. You will see the jawline is improved. The cheekbone is more plumpy and repositioned. And the eyebrow as well. Sometimes I got like 1 centimeter difference on the eyebrow. And the question is, how long does it stay on? Well, it depends. If it's a younger skin, like in her case, and I only do 1 session, maybe it will stay for like 10 days or 2 weeks. But then if the idea is for her to come 5 sessions in a row, then the effect and result, it will stay for a very long time, because as well I'm working with active ingredients, yeah, which are going to give me this firming and tightening and long-lasting effect. Plus, if I do 5 sessions and then I continue with once per month, then the effect is even going to be more prolonged, yeah. Plus, when I do the mesotherapy today, it's like I give now the food, but then I need some time to digest. It's the same with the cells, yeah. So the best result and the optimum result of what I'm doing today, we will get after 48 hours. Evelyn, how are you?
Good, feeling good.
Is it painful?
No.
Good. Important, especially for somebody who is very cautious and conscious of the pain. Okay, I will change now the parameters because I'm going to go for the upper third, and I'm going to leave the electroporation on 3, so penetration of the active ingredient on 3. Contact degree, I'm going to go down to 2. Let's see how it goes. Open your eye, please. Don't worry, it's not going to be painful. We apply the product. Is it painful?
No.
Good. Okay. Evelyn, what is the product you're using around the eyes? And it has this problem with the milium being there for long?
Yes, more than 20 years.
Oh, okay. So it's not about the product that you got and it's too nourishing for you. It's just your skin is more prone to blockages and getting asphyxiated. So exfoliation is very important in such cases. Okay, I applied the product and I just pressed the cavity button. So now it's closed and you can see me. No, you can, yeah, you can see. You can see that I go outwards, but then as well, this is the only area where I can go kind of backwards. Yeah, looking for this extra draining effect. And every time I go out, I press and I stretch the skin. So we get this extra lifting effect. And if there are wrinkles, I will just go on each one of the wrinkles like several times. If I don't see the wrinkles, I can squeeze on the skin and see where she will have the wrinkles if they did not appear yet. Okay, and then we will work on the upper lid until where we can support ourselves on a bone structure. I'll not work on the eye, on the eyeball. So we do 1 or 2 or 3 lines horizontally, penetrating the product, and then I'm going to show you the anchoring points as well. This is the most painful one because there is an important nerve underneath, so it might feel a little bit uncomfortable. Plus, us women, with the hormonal changes of the menstruation cycle, what I can tolerate this week maybe is not what I can tolerate next week. Yeah, sometimes we are more sensitive as well. If I am sick and my immune system is low, I am more sensitive and less tolerant. As well, if I did not sleep well and I am very tired, I am less tolerant. So all of this will influence. But there is no problem because the only thing I need to do, I need to maybe lower a bit the frequency. I can even lower the contact degree even while I'm working. And so I get down to 1. I don't need my patient to suffer. Are you okay, Evelyn?
Yes.
Good. So she can tolerate, and then I want this extra effectivity and efficacy. So my parameters right now, electroporation is at 3 because she has some tissue which, you know, permits deeper penetration. It's not too thin. So I prefer to go deep and get the extra effectiveness. And as well, contact degree is on 2. And as I said, I really like working as fast as I can, and as the case permits, frequency is at 5. Okay. Then we can open the cavity and apply on the forehead, half face, and then I recommend you to sit up the customer and give them a mirror. Because there is always a difference. This way of work is just a plus. How we work is just what you see right now. Horizontal, line by line, covering the whole area, then going vertical, line by line, and you can do this 2 or 3 times, and then you're free to go for the next area, yeah? But these anchoring points is something that we saw with time and with experience that we can get a very good effect in terms of lifting. And as we said, it's perfect for when we have something special or just to impress our customer even more. Anyway, we are working with a device, why not to give this extra power and effect and result. If you have wrinkles, you can work on the wrinkles one by one, like on the line directly, insisting several times, stimulating the area and working on the wrinkle. So I wanted to say something and then I got lost. Okay. Half face is done. We will invite now Evelyn to please sit up. I had a mirror somewhere. Ah, yeah. Yeah, thank you. This is our TOSKANI med mirror. Can we please have the camera on the face or not? Please. What do you think, Evelyn?
Feeling fresh.
Feeling fresh? I can see puffiness is less. Can you see the puffiness is less, guys? Huh? Can you see the eyebrow is higher? Do you see better, like your eye is more open or?
Yes.
Okay.
Yeah.
This is less puffiness. Wrinkles are less. And look at this. Look at this. The nasolabial is less visible. This area is more plumpy than here. This is, you can see it's emptier. This is more repositioned. On the, look at this. We don't have it here. Guys? Yes, okay. Sorry. Yeah, that's fine. Do you see this area? How it has gone up on the other side? Yeah. And look at this. This is emptier and lower. The cheekbone here is like the whole area is repositioned. Eyebrow, it's not as impressive as it usually goes, but still it is higher, and she has the sensation of the eye is more open. Why? Because we lifted up. Yeah? And as well the puffiness.
Yes, this is the best.
Because I'm sure this, she says this is the best because I'm sure this is what she sees as a problem and bothers her. Hmm? Yeah?
Yeah, every time, every day.
And I'm sure that do you feel this is like on the other side somebody is like pulling you up from here? Feeling sensation? You have to help, because if I ask her, she will say I feel fresh. Okay? Now if I tell her you can see better with this eye, it's true, because the eye is more open, because the eyebrow is more lifted. So, questions, suggestions?
It's easier to open the eye, like...
Lay down, please. Yeah, I know we are out of time. Do you have any questions, guys? Please. Questions, suggestions, anything? I can start changing the parameters and start from down here. No need. I can just go downwards, because if not, I need to change again afterwards, yeah? So I will just work on the eye first, because if not, I cannot do this. If I have the product still here, I cannot lift up. You say nothing. Why you say nothing? I want to hear your opinions, please.
They are amazed.
They're amazed? You think so? They don't show.
Estonian people.
Estonian people?
Yes.
Ah.
Just not telling that.
Not showing that much?
No.
Okay, that's fine. As soon as you like it. Do you like it, guys? Yeah? Good. Thank you. In Spain, it depends. You know, it's a device that can be worked by cosmetologists, and as well it is a device that we sell to the clinics, because it's a very safe way and not painful, and no side effects in terms of, you cannot, like if you do a needle mesotherapy, You can have hematome, you know, here no. So usually if you go to a clinic, even though the device is the same and the product is the same and everything is the same, the price together with a peeling and everything, it can be like 200 euro. But if you do the same treatment with a beautician or cosmetologist in a beauty clinic, in a beauty studio or in a spa, in the best places, maybe it is 120 with everything. So it depends. How much do you charge here? Jedre? Uh-huh. Mesotherapy and peeling and mask? Mm-hmm. Yeah, it always depends if you're in the center in a luxurious place or you're in a small village somewhere in the middle of nowhere. Mm-hmm. Because it's not painful as well. It's not invasive. Yeah, and the effect is immediate. And Evelyn, who is scared from pain and stuff
needles.
and needles, and as well has a sensitive skin, you can see she's so relaxed. She seems like as if she's sleeping la siesta. Yeah, good. At the end, you know, customers' comfort and will to get back, because if this is something painful and not effective, they will not come back. And you win their trust as well. If you are able, if you're promising them certain effects and results, and then you're able to provide them with what you promised, you have a happy customer. And when you recommend to your customer certain products for home care, they will be more open to follow what your indications are, right?
What is best after this procedure for me at home? What I can use? Cream or serum or which kind of anti-age?
I can talk about our products
Yes,
because
our,
this is,
yes, your product. Yes.
I think for you, maybe retin would be a good option. But because your skin is a little bit reactive and the redness that we can see, it is showing that is a bit reactive. Try some samples before, even though it's for sensitive skin, try how it feels on you. The glacier serum would be as well good for her because she needs moisture. What else? For this area, we need this extra exfoliation, and we have products which are like chemical peeling for home. They're based on acids, like we have what's the name? Clarifying Peel Booster, where we work with glycolic together with phytic acid, glycolic on 20%. It's quite a powerful product. It's for hyperpigmentation, uneven skin tone when you want to brighten and lighten. Then we have impurity, imperfection peel booster. That one is perfect for impurities, oily, acne-prone skin, and this one is the one that I would recommend for you, for this area especially. Once in a week or once every 2 weeks, like a peeling at home, you can work with it. and it is going to help you to continuously, you know, avoid this blockage in this area. And I think retin would be good option for you. Good question. It depends on the pregnant woman. If she thinks that, you know, these products are not systemic, they don't go in the blood flow, okay? So this is not going to harm because the electrostimulation is only on a localized area, right? So we don't have clinical studies done on pregnant women, but we can, you know, give them all the data sheet of the products and device we are going to work with, and they can go to their gynecologist and show it, and so they can get their okay, right? So it will depend if you know that person is, you know, okay with stuff. Because some women, some pregnant women, they go crazy and whatever happens with the baby, it's your fault. No, you know. So it depends on how are they up there, okay? So once we are finished, we press the camera, please. We press the stop button. Stop button. Set button, and when I press the back, the device is going to, it's waiting for the replace confirmation, like it's going to move on its own, yeah? Then I remove the syringe, I extract everything that's inside, and of course I'm going to apply it on her skin. Do some massage. Evelyn, how are you?
Oh, feeling very good. Not painful.
Not painful. Good. Patient's experience, very important. Not painful. So, would you repeat this procedure, Evelyn?
Of course.
Nice.
When you will come back?
Well, even if I'm not here, I'm sure there will be many people who would be able to provide you with such a treatment, right?
Yeah.
Who's working with this except for her? Nobody else, huh? Not yet? And you know the device as well, it's only 2.5 kg. It doesn't need much space, it doesn't occupy a huge area. You can move it from one cabin to the other if needed. It's not heavy. So it's very practical. And even though there is some redness, I don't really mind. Now it would be the moment to put a peeling off mask, shall I, Giedre? Okay. Can I please have Dexanil? Because I want extra calm and repair. No Dexanil? I always have with me Dexanil. This is mine, and it comes with me everywhere in the world, in case. So they have. Okay, then I keep it. In case one day I need it. Okay, so Dexanil, we said is what? Our SOS, help. We can see where we insisted on the anchoring points. We have some redness. It's normal, it's okay, there is no problem with it, it will go. Now, just for the comfort of my patient and this extra speedy recovery process, I can open, apply manually, and the rest of the ampule we said we're going to put inside the mask. Yeah? Good. This even after sun exposure, like when the sun, the skin is very, tender and affected, we can apply in order to speed up the recovery process. I'm looking for, yeah, thank you. And then I'll put anti-aging mask here. This one. We open, it's a peeling off mask, alginate or plastic mask, however you want to call it, it's the same thing. And you know that this type of mask has a very, very good occlusive effect. So you empty the totality of the mask. Evelyn, can I apply on eyes and lips? Do you have claustrophobia? No. Okay. Okay. No, it's not painful, no. This is very pleasant. It feels cold and heavy, but it's not painful.
It's a little bit warm some places yet.
This will give you calm and peace. This feels cold. So what we do is on the dry texture of the mask powder, we move to oxygenate. And then we mix with, I would recommend, drinking water. Drinking water because we don't know how harsh and hard the water is. 90 milli. Mix a bit, then you can add up more water. 90 milli we said. I think I never measured it. Just look at the texture and you will see me. It gives you enough time to work properly without the need of rushing too much. It fragwates, but it doesn't fragwate that quick. Okay, so you mix. You have a homogeneous texture. You can add up just a touch of water more. And then once we have mixed the water with the mask, I'm going to add up 5 puffs of Hydro Bamboo toner, giving it extra moisture as well. This 1, 2, 3, 4, 5, extra calming, healing, regenerating effect because of the aloe vera. And to this mix, I'm going to add up as well the nearly totality of the Xanil ampule to help speed up the calming and healing and repairing effect, and as well remove the redness. You will see. If we would have enough time, I would leave it for 15-20 minutes in order for the product to be able to act properly. But since we don't have that much time, we'll just apply and most probably remove quick. It's important to apply a thick layer. Sorry, I'll leave this here for a second. Lift up. Okay. And then we apply the mask on eyes and lips. Be careful if you have eyelash extensions. If you have eyelash extensions, please don't apply on the lash. Because you can, you can remove some of the lashes when you remove the mask. No need. It feels cold, right? Nice and calming. Nice and calming. And for the eyes, if there is puffiness and sensation of tired eyes, it as well has a very good decongesting effect on the eyes.
Good smell.
Good smell.
I don't like all the cosmetics.
Evelyn is a bit picky with the smell, seems like. So thank you. TOSKANI is not a company that, smells like perfume. And as well, if we have some aroma, they're usually very subtle. Nothing strong or too much, Okay, I'll go for the eyes. Okay. The other eye. The nose. And the lips. Do you think it's fast enough, slow enough, gives enough time to fragwait, guys? Gives you time enough to work properly without having to rush. Yeah? And because of its occlusive effect and action, whatever I have applied until now, it's really going to make it penetrate even deeper and in a more optimum effect way. Questions? No questions? Okay. To remove the microchip, I hold it front and back, upwards, and then towards me. And we're done. Yeah? Good. This never ever wash now. You can remove it right now while it is still humid. You can as well leave a cotton, a paper piece, so once it is dry you can just remove everything at once, or you can, while it is still wet, clean. Because if you wash this in the sink, it will be blocked, because it becomes like a rubber inside. No questions? Yes. Products. Yeah, for rosacea, if it's acne rosacea, red spots. You can do AUX 360 together with Dexanil, together, mix and work with MESOJECT GUN. You can work AUX with Asiacen, one of the ampules, the monodoses. The peeling, of course, will be usually mandelic or lactic, because it's more gentle. If the skin permits, you can put as well salicylic. This is the home care ampule. Yeah? If you look at the mesotherapy, the AUX, AUX together with Dexanil, or AUX together with, but you don't have it here, Asiacen. Yeah. Okay, so we're ready with Evelyn. We will remove the mask, even though, as I said, we would usually leave it for like 15-20 minutes. And we will not remove with water anymore. If any rests, we can just take a gauze with some toner, because we're not interested into removing anything of all the amazing stuff that we have applied on the skin. Hola. How are you, Sleeping Beauty?
Oh, very good.
Yeah?
And not anymore warm. The face is not anymore.
Sensation of calmness. Even though there is still some redness, but it will go. It's okay. I'm not bothered. I'm not worried. It will calm down. Okay, so whatever I have as leftovers from the mask. I'll just remove with a bit of gauze with tonic. But usually, as you can see, it comes out by one piece. So it's very practical, it's very easy to work with. And as I said, like if we would leave it here for like 15, 20 minutes, this little redness that she has on the certain areas we have insisted a little bit more with our anchoring points, it will completely disappear. So I had a dermatitis, which I didn't know it was dermatitis. I didn't know the lady had dermatitis before we started the demo, and she had a severe redness reaction. After half an hour with the mask and Dexanil, she went completely calm. This happened in Romania. I was quite freaked out because people don't know the brand. First time they see the brand, and I talk magic about the products, and then the customer, she went so red, but like tomato, and full area. And then the calming effect was so impressive. It was like 70 ladies in the room. They all like started to applaud, and it was nice, very nice. And I was very happy because imagine the disaster of the launching of a brand where you had like really bad experience. So it was good. We finalize usually with Total Recovery Gel, and this is a product with a very high concentration, once again, of aloe vera, collagen, and wheat protein extract with firming effect. And this is my product. I bought this big size because we have the professional. And my product for summer, like morning and evening. I love it because it's very light texture, quick absorption. It gives me this sensation of comfort. So for mixed oily skin, it's just perfect. And it's a product that really moisturizes the skin, but without much other stuff, you know, like an aging person needs some extra. Okay, so this you can use after any procedure. TOSKANI or not TOSKANI. You can do maybe a laser, and if they have this burning sensation or heat feeling, you can apply the gel. It immediately calms down and speeds up the recovery process. And it's very light, quick absorption, pleasant feeling. Yeah, good. Thank you. How is the weather outside? Do I need to apply SPF? Is it already kind of dark? Because my idea is for her to not wash today. To go to sleep like this, you know? No need to... No, but if, you know, even if there is no sun, there is light, and UVB are very strong, even when it's cloudy. But good. Okay, so we will live like this. In Spain. It's crazy. Yeah, we have 23 degrees the other day. Not normal. Yeah, not normal. We want rain. We need water. It's a disaster.
We have 5 weeks already rain,
Oof.
almost every day.
Yeah, wow. Send some water to us. And this is a way as well to say bye-bye, we're done, you know? Instead of saying, hola, we finished. You know, we activate the muscles with some firm pressure. It feels very good.
Super.
Good. Well, thank you very much, Evelyn.
Thank you. Thank you.
How are you? My pleasure.
I'm feeling like 15 years younger.
Good.
I'm breathing.
She feels she's breathing. Yes. This is because of the good exfoliating power of the products. And then in terms of mesotherapy, we worked with anti-aging. But moisture, antioxidants, vitamins, minerals, firming effect. Do you feel your face is like lifted?
Yeah. And something is like here, like
Firming?
yeah.
DMAE, dimethylaminoethanol. Instant feeling, sensation, lifting. Thank you. Sweet of you. Thank you very much.